Hi, welcome. It's Matthew Holt. I am the proprietor, chef de keep of the THCB gang, and it is now episode 38, January the 14th, 8 days after the insurrection and 7 days before the inauguration in political speak. And here's today's THCB gang. Really looking forward to the group that we have on at the moment. So bit of a chopping and changing from what was advertised, but here's who's actually here. Jessica DaMassa, my co-host of Health in 2.0 and host of WTF Health, who's been burning up the interview stakes lately. Mike Magee, medical historian. Casey Quinlan from Mighty Casey Media and host of the Healthcare is Hilarious podcast. Lygeia Ricciardi, Washington, D.C. Brave resident and CTO of Carium startup. Neptune from New York City and CEO of Suntra Recovery. And from the wilds of Idaho, Vince Kuraitis, policy and tech consultant and grand poobah. So let's go live. Here we all are. And I guess the answer is, guys, we've had an interesting week, right? We did a TCB gang, which I was on, but none of you were on last week, in which we were kind of talking about the Duck Dynasty insurrection, as Ian Morrison called it. And I guess it wasn't really, right at the time, the seriousness of what happened didn't quite come out. But that has happened. And since then, we've now had an impeachment, a second impeachment. And we're looking forward to, in just 6 days, a new administration. And that's just the politics side of things with nothing on healthcare. So obviously that weighs, I think, on everyone's mind. But let's go around and see what people have been thinking about the last week or so. So, Lygeia, I will start with you, as you are actually in the maelstrom of DC. Tell us how you're doing. Hopefully all is okay there.
It is. I am keenly aware of the situation literally down the street. And I try as best I can to stop myself from reading news 24/7, although sometimes it's important to do so because it's relevant to my life. I do want to bring up a non-political thing that's been going on this week, which is CES, the Consumer Electronics Show, which I have been speaking and participating in. And that has been an interesting and welcome break. So happy to talk about that a little bit and some of the trends, if that fits in with the flow.
Yeah, no, and I think we'll get to that because there's some interesting stuff also. This is also JPMorgan week. I know Jessica and me are, our livers are having a welcome rest. Given we're not actually there, but, there's a lot going on in the world of healthcare. It's somewhat being overshadowed, but, it's going to have big impact. All right, JL from New York, what are you saying?
What am I seeing? I'll start simple because there's so many other things we could talk about. Did see that the Department of Health and Human Services has extended the pandemic the pandemic emergency waiver through April. So what that means, and with that, the waivers as they apply to the utilization of telehealth and the empowerment of different types of providers to use telehealth. And by the end of that waiver, and I believe that waiver will probably be extended further, we will have been more than a year with consumers being very accustomed to their doctors using telehealth to interact with them. And I have said in many places, it's hard to go back. It's hard to put the toothpaste back in the tube. And I hope that of the many bad things that come out of this pandemic, maybe one of the good things will be that it has forced us to move into the 21st century in terms of using technology for healthcare.
Yeah, that's pretty interesting. We're actually, there's been some chatter on Twitter today about how much we've regressed in use of telehealth and how it's going to change. A topic I think that Vince knows something about. Vince, why don't you go next? Don't have to talk about that, but
Happy New Year, all. I'm going to piggyback off of Lygeia's comment. And Lygeia, I hope you'll talk to us more about your presentation and whatever else you may have picked up at CES. This morning, I read what I would label as an enlightening and telling story about CES. They announced the winners in different categories. And the winner of the digital health and fitness category was a device manufactured by Omron. And what this service does is it takes people's blood pressure and it automatically sends that blood pressure to the doctor and to the doctor's EHR. And my first reaction reading this was, wait, this has got to be 1998, there's not a comment on Omron. I'm sure they're trying to do the best that they can, but I think it's an incredibly telling comment on the state of EHRs, where the winner of the Consumer Electronics Show creates a blood pressure monitor that somehow gets information into the electronic health record. That's my insight of the.
Haven't we come a long way? All right.
Yeah.
Jessica.
Of course you would make me follow that. Okay, so I'm looking at, well, being as it's JPMorgan Healthcare Week, of course, health tech funding is top of mind. And we covered this, Matthew, on our show. We're talking about the two fundraising reports that come out. They usually come out quarterly, but the annual numbers are in for 2020. Rock Health says 14 billion invested in health tech, digital health. Startup Health, more optimistic, 21.5 billion last year. And that doesn't count any of the publicly traded companies. So no, that does not include the $18 billion Teledongo deal. So insane numbers. And then it's like, the question is like, usually at JPMorgan, like what's going to happen this year? Already $300 million round closed by Hinge Health. Talkspace is filed for an IPO via a SPAC valued at 1.4 billion. Like this is not ending yet, which is just crazy. But I will say this, there was this one little nugget in Med City News about Andy Slavitt's chat at JPMorgan Healthcare, and he's predicting that the incumbents are going to push back hard on telehealth and digital health over this next year, because he's saying there's a lot of protected interests out there. And he equated and he gave this great analogy about how it's like everybody says they don't like surprise medical billing until it's like their business that's going to be hurt by not sending that surprise medical bill. And so he's looking at it in that way. And I think that that's a very valid point. I don't think that we've seen the end of the incumbents and their pushback on telehealth. Although, United Health Group just signed a big deal with Amwell to provide this virtual first primary care to their big employer group clients. So maybe not.
Absolutely. Mike, tell me what you're looking at this week.
Matthew, this has been one of the more unusual weeks for me because I got pulled away from pandemic immunization supply chain issues, which we were quietly working on with a couple of governors, and asked to pen an op-ed from a medical historian's point of view on this insurrection. Is there anything in our history that informs us in terms of how to approach justice and insurrection? Because as you know, Republicans were saying, can't we all just get along? Can't we all just forgive and forget? And in working on that, there were two specific cases that I summarized this week. One was in Germany in 1945 and the other South Africa in 1995. Both of them combined distributive or retributive justice and reparative justice. In Germany in 1945, as you know, there was a Nuremberg trial, and a big part of that was the medical trials. 23 defendants, 7 were hung, 7 were acquitted, 6 were sent to prison for 10 years to lifetime. So certainly an example of retributive justice. But at the very same time, through the Marshall Plan, we committed our own taxpayer dollars and created a national healthcare system for Germany. That's an example of reparative justice. And in fact, the reason we did that was because, as they quoted then, nation building efforts are more successful if you have a healthy population. Similarly, in 1995 in South Africa, as you know, Nelson Mandela launched the Truth and Reconciliation Commission. Over 1,000 meetings were held over that following year, and those offenders were invited to come forward to request forgiveness and to seek amnesty, which the vast majority of them did receive. But what is little known is that at the very same time, Mandela launched a universal primary care healthcare system for all South Africans and built over 500 clinics for this care to be delivered. So again, combining retributive justice with reparative justice. So as we look at what's happened here, the analogy would be that you gotta not only convict Trump and investigate all the others that did this and go after them hard with all that's available to you in the law, but at the very same time, it'd be a wise thing for us to push forward on universal health care as a first step in reparative justice and a way, arguably, an effective way to address income inequality in America. So that's what I was
great points, and we'll have to try to combine that in with the mania in the stock market and the recreation of primary care that's actually going on. And actually, last week Jeff Golseth had a word about how to do that, and then we better off extending Medicaid, or we better off doing spending more money on FQHCs, and how do we get to that? But obviously, as it's tried to point out, a lot of the people who are in rural America who are suffering or not doing well, who may be attracted to populism and extremism, other kinds of people who need those kinds of programs. Casey.
Hello. Well, anybody who was celebrating the beginning of 2021 as some sort of way to get rid of the stink of 2020, sorry, dude. Sorry, dude. I kind of knew that it was going to be a hot mess because, it's not like it's like birthdays. I don't feel any different. Well, you aren't. You're still here. It's, time is still a river anyway. But I'm going to springboard off of what Mike was talking about and say that a lot of my thinking, both before the Al-Qaeda attack on the Capitol and after, has been, and particularly after, has been how that particular event had really once again magnified the difference in police behavior toward people with white skin and people with skin that is not white. Because if you side by side, and actually the Washington Post has a really good piece today that does exactly that side by side between the actions in Liberty Park and around BLM Plaza, et cetera, around that area, with Barr basically sicking the entire federal law enforcement engine on people in the street, including journalists, and tear gassing and flashbanging and rubber bulleting them. Oh, lovely. But a bunch of white guys, they're coming in. Oh, they're in. And everybody's just kind of going, oh. Meanwhile, at least somebody had the stones to, repel with a bullet someone who was attempting access to some of the inner sanctum. And she did not survive that experience. But, it really puts into sharp relief the fact that America's original sin has never, ever really been accounted for nor remediated. And the principles of restorative justice, the principles of restorative justice, to which, Mike was referring, he didn't use those exact words, but the principles of restorative justice is to restore to whole the offended party, whoever that is, in whatever situation, and then to ensure that the community itself understands its part in this if it is a community problem. And I think we need to finally have an honest conversation about this. Yes, we need to get healthcare to everybody, RTFN. So I would really like to see that happen quickly. I don't want to see, the Biden inauguration in first 100 days bogged down in a bunch of, but what happened before the 20th? I think if somebody could set up a panel, go do that, be over there. We're going to work on healthcare access and COVID and racial justice. But, I after all the years I spent in the front lines of the network television news business, this is the worst thing I've ever seen inside our borders. And to watch the media pen, where I spent a massive part of my working life, literally torn apart and stabbed at, the crews and correspondents stabbed at with Trump flags and other Confederate flags. First time the Confederate flag was ever inside the Capitol. They identified that guy, by the way, and they've arrested him. He lives in Chester, Pennsylvania. Last I checked, that was part of the Union during the Civil War. What the heck, guys? So, but I mean, it just shows that it's a white supremacy world and we got to change it.
Mason-Dixon line clearly is moving north in some people's minds anyway, for sure.
No, I think it's a race completely. Now we're just all in this toxic soup.
We are. Well, I mean, look, a lot going on there. Let me start a kind of odd place. I want to bring Jael in on this. A lot of what I think has happened in America, and then the narrative we heard a lot about is people being left behind. And, we talk a lot about Black Lives Matter. We talk a lot about sort of rural white working class and the rest of it. A lot of that has been impacted in terms of access to healthcare, and then we talk about the decline in life expectancy. A lot of that's to do with the business that you're working in now, JL, which is managing, addiction and opiates. You obviously thought a lot about primary care, care management. You're obviously in the business now of doing care management in this particular niche. Meanwhile, to go back to Jessica, what Jessica was talking about, all that money that's pouring into the stuff that Lygeia was looking at CES and that Vince and Jessica were talking about, a lot of that's going into niche different approaches to primary care. I'm trying to connect two things that are very different here, but I mean, are we going to be able to think about a restorative, some kind of restorative play out of the Biden administration, which uses some of this new technology, or what do you think is the most, from your view, the most effective way we could start thinking about rebuilding primary care?
Good question. I mean, the first thing I'd say is I give President Biden a lot of credit for saying throughout the campaign and through this time that he wants to be the president for all Americans. I think, again, just starting there, that phrase, that saying, just saying those words, I think means so much, because his predecessor was pretty much clear in telling people that he was only the president for a certain part of the population. So I think starting there and saying, even though maybe, Republicans have lost, Joe Biden is going to try to help people. So I think that's very important in setting the table. I continue to believe, and I had this discussion with somebody yesterday, that a root of a lot of this dissatisfaction is fewer economic opportunities. There's a lot that makes people crazy, right? Not being able to have financial security, not being able to have the things that you want can make people crazy. And I think one of the big things there, if you survey people, is lack of access to healthcare. We still forget that we still have something like 30 million people who are uninsured, and even people who have insurance. I mean, remember, the number one cause of bankruptcies is medical debt, right? And, as we talk about surprise billing and all that stuff. So I still think that I really believe that healthcare is the root of a lot of crazy behavior that people are demonstrating at this point. And I really do believe that when we look back many years from now, we will look at this era as almost like, the 1700s in Europe, where you'd have these mass manias, where there was like list mania, and all people would, thousands of people would act in crazy ways that they could never figure out why that was happening. So I think that addressing healthcare can get to the root of a lot of problems that we're having. I think Biden has prioritized that. As you know, Biden's daughter is married to the brother of the founder of Startup Health, right? So Steve Krein and Howard Krein are related. They're brothers. And I think that's going to give us a seat at the table very close to the president to be able to ask, how can we get resources to use technology to distribute healthcare to many, many more people? And I think that, these technology solutions that we're talking about, Hinge being one of them is a great example, but many of these primary care solutions will hopefully allow us to reach out to more people who have medical problems, who need to see a provider, who need a prescription, who need access to healthcare. And I think that is a really important thing. I will say, going back to what Jess was saying, there are a lot of people, though, there are many interests in this game, right? And there are many, many people who stand to lose a lot of money, many organizations more so than people, if you expand the digital reach of healthcare. So I think that's one of the things that we're going to have to address as well, and talk openly about incentives and interests grants and all the different ways that this money flows through the system. But I think Biden has signaled that he cares about those things. I think he has close relationships with the people who can help deliver these kinds of solutions. And my hope is starting early, we can start moving in that direction.
Yeah, one thing I'd add is that there's still this sort of dichotomy between going after the employer market. And when you say going after the employer market, you're really talking about relatively high wage employers or these big corporations and state employers. No one's coming up with how do you get healthcare to the restaurants that are the mom and pop restaurants that are closed down. We still haven't really seen a plan for that. But in terms of that, people like in Lygeia, this is obviously a business that you're relatively close to, given what you're doing with Carium. But people like Teladoc now has come up with its new, just announced at JPMorgan, a new primary care-based sort of virtual care program. We're seeing a number of the SPACs that have been announced have been sort of for Medicare Advantage, Medicaid-focused medical groups. Jess, you talked to the folks at Crossover Health about doing stuff with Amazon. I'm wondering if, can we see those new types of developments of primary care. On the other hand, the people whose offices are being called, or the people who are providing care in rural areas in the cities aren't really in that game yet. Or am I being too pessimistic? This is for anybody who wants to jump in.
I'll jump in. In the rural areas, I think that's why we saw those big FCC grants earlier this year in the pandemic to try and extend broadband. Because I think one of the risks of COVID that we're seeing, there is a real intensification of these gaps between the haves and the have-nots of whatever kind. And I think that the more that starts to continues to attenuate itself, the worse our political problems get. I think increasingly people across the country do have access to smartphones statistically. Broadband is increasing, it is rolling out. Is it enough? Is it fast enough? Some of it is. Another way that I think about healthcare and the political situation, which is sort of a weird relationship, is how people are handling sort of social distancing and behaviors and thinking about everything from mask wearing to vaccination. And so it's not just that you've got people who are otherwise not having access to service who are clamoring for it in some way, although it may be contributing to their overall sense that the world is broken for them. But then they're actually out there exacerbating the pandemic by yelling at one another without masks on. And so it all gets very convoluted. And technology also, in some ways, can be, of course, part of the problem through remote monitoring, through telehealth, all these other things. And at the same time, the flip side of technology is that it's radicalizing some of these groups and their beliefs, political, health-related, and otherwise. So it's a really complex mishmash of forces going on out there. I think a lot is possible, but I think a lot is going to depend on the next couple of weeks and kind of getting through. I don't feel like we're at this point yet where we can look back and say, like, everyone calm down, let's all move forward together. Like, there's still a lot of anger and trouble. You can feel it in the air. And we're not through it yet to that reparation point. And I think Joe Biden is the person to do the reparation if and when we get there, but we're just not quite at that phase yet.
Yeah, I think, Lygeia, the mistake that could be made at this moment is to think that any of these things are short term. This is very similar to the beginning of World War II, where FDR had to fight an actual enemy, as we do have to fight directly and confront white supremacists, which will be a militarized combat kind of an effort. That is going to have to move forward. That's why Washington is occupied at the moment. But at the very same time, we have to address the pandemic. And if you look at the pandemic, the challenges there are finding out how to create a national system response. I was in on a couple of private phone calls this past week that involved CVS, and what was their pitch? Their pitch was, we're national, we're within 10 miles of almost every American. We already have the deep freezes, and we have a workforce that can inject. But most importantly, we have the database. We already are sending out alerts and communications to all the people in our network, so we can inform them that here's where you get your shot, here's where you come, and we can deliver it. Now, that kind of points the way to the group of skill sets that will be required, at least for the public health component of a new universal healthcare system, and that the IT capabilities are going to be at least as important as credentialed manpower and the ability to get product into patient.
Yeah, dead right, Mike. You've got you've also got still people are getting their certificates on a piece of paper. There are some people working on that. I know that talk about right. Okay, so let's go to. I'm looking at the chat here. Let's go to JL and then Casey.
Sure, and Mike brought up a point up, and I'll get to that in a second. But I think one of the big things that a lot of people don't understand is how heavily over-engineered our healthcare system is, right? And the standard that we set at the lower end for delivering healthcare, and how that drives cost, and how that makes healthcare thus unavailable to people who don't have discretionary income or who do not have insurance. And I think one of the things that we really have to think about doing as a country is asking ourselves, is it better to maybe have a second tier level of healthcare access than having no healthcare at all? And like, for instance, a big thing that we do is, we're helping people who are dealing with opioid addiction, and we're giving them access to buprenorphine as a way to help them deal with their addiction and to get into a place where they're not using heroin or other substances illicitly. There's still a lot of people in the medical world who are like, you have to see those patients in person. Once the pandemic is over, you must see those patients, right? Each one of those patients has to have a urine tox every month or every 2 weeks or whatever that is. And that's all very expensive, right? Is it better to just say, hey, listen, that guy who's out in West Virginia who doesn't have a doctor within 50 miles of him, is it okay to just give him a phone call with a doctor or maybe a nurse practitioner and provide him a prescription to buprenorphine, realizing there is a chance that he may misuse that prescription, but it's better for him to use buprenorphine and maybe achieve a recovery on his own than to continue using heroin or whatever he's using. So I think a big thing is like a change in the mindset in the medical community that maybe can be compelled to some extent by the Department of Health and Human Services by providing more people throughout, more providers, licensed providers, and maybe even people who are not licensed providers, the ability to deliver some of these services. And I hope that the pandemic helps change that mindset. And one of the examples that I like to use is right now in New York, we're trying to roll out vaccinations for the COVID vaccine. I was contacted, and I can honestly tell you, it is a disaster. I mean, like, I signed up, let's say, on a Thursday, and then on a Friday, I was assigned like an 80-hour shift beginning the next day or something like that. My business partner, Adam, went to a location in the South Bronx, hundreds of people, many people turned away. I mean, it was a disaster. But as it relates to the vaccination, let's find anybody who's ever held a needle in their hand. Like, giving somebody a COVID vaccination is very simple, right? Find the medial deltoid, put the needle in, make sure you're not in an artery. That's it, right? It's very simple. And I think trying to empower as many providers who are, let's say, below the level of physicians to provide healthcare is something that I think could be very useful and could really democratize healthcare. Again, you're getting at the physicians guilds, the 50-state physician guild, the national physician guild. That's a big problem. Physicians have a lot of vested interest in the system. And I say that as a physician, but I think trying to address those issues and, in the spirit of restorative justice, like saying like, this is the problem and talking about that problem openly might be a way that we can get more healthcare to more people. And if more people are getting more healthcare, hopefully they're acting less crazy.
Casey?
Less crazy. Let's all aim for less crazy in all things. But yeah, to springboard off of what Jean-Luc just said is to say that we touched on the 50-state physician, groups, societies, whatever. And that 50 state thing is one of the biggest things standing across deployment of broadband nationally, a lot of things around healthcare delivery, licensing, and who can practice and who can do what to whom. I read something recently, and I can't remember exactly where, but is it EasyJet? Yeah, it's EasyJet in the UK. The NHS, shows what you can do with a national health system. The NHS has partnered with EasyJet to turn its flight crews into COVID vaccine delivery guys, gals, whatever. And that's just one example, but that's, an example that has legs, springboarding off of what Jean-Luc said. But the 50 state issue is the problem with healthcare costs, because every state wants to, everybody within every part of all of healthcare is constantly in what I call the wet my beak mode. All of those middlemen, all of those administrative things, all of those guys, I'll make your practice easier to run if you put me in full control of your financial side, that kind of stuff. And, that's where, really extractive billing practices come from. And, I think the consultants in healthcare have a lot to answer to, but also getting the tech deployed that will really help people, especially in rural areas, is proceeding at a snail's pace. I'm not sure who the FCC commissioner is going to be, because I haven't tracked that, but whoever that person is, they need to really beat into submission some of the telecoms, some of the internet providers, to say, what, if you refuse, because they get a lot, those telecom and ISP guys get a lot of federal fund called money, and all kinds of tax breaks and whatever. It's like, no more tax breaks for you until you fully cut, every place you've got a tower, you got to tell me that, for 50 miles around, everybody gets broadband who has your phones.
Yeah,
Hey, I want to bounce off.
Let me jump in, just because I'm in the terribly disadvantaged
You're the big cheese, all right.
I'm coming to you, Vince, but I'm in terribly disadvantaged road in Squaw Valley, California, where I'm on. You're seeing this on AT&T DSL. That's still a thing, but here it is. And I'm trying to get. I think I've succeeded in getting cable internet in next week, but there are large areas of the country where that kind of link is really a problem. And I think one of the things Lygeia raised is that's dead true. Let me go to you, Vince, but I want to bring up. Go to you, Vince, and then I will come in because I want to talk a bit about what Optum's been up to this week. It's been quite a lot. Vince.
I want to bounce off of Casey's comment about consultants and share my favorite definition of a consultant. A consultant is somebody who knows 121 ways to make love, but doesn't have a girlfriend. And being a consultant, I share that in good humor. So I'm not sure where the topic is here, but I'll try and offer some perspectives. Part of the richness of this Thursday afternoon group is we're all coming through this from different lenses of the world. So I'm going to try and connect a few dots. The original question you asked was about, reinvigoration of primary care. And I'll offer my own comments. I work with companies really around their business strategy. And I can't remember who said this, but it's a quote that sticks with me. In the digital world, there's really only two ways to make money. There is unbundling and there is rebundling or bundling. And in the context of healthcare, Jessica, you point out that we've had 14 billion, I don't know what the number was, of investment.
That's right.
And most of that investment, if you look in the rearview mirror, has really been targeted at unbundling the incumbents. And some of the best perspectives of this have been graphics that have been put together by a company called CB Insights. And they paint a picture of a hospital and the hundreds of different companies that are taking a very small aspect of that hospital and making it very specialized. And last week they had a graphic around the unbundling of primary care. So the question you're really asking is, we can have better primary care, recognize that there are all these dozens of companies that are trying to take it apart as well, to take virtual visits, to take, laboratories out of it. So we've had this, but looking out the windshield, what I see happening is really the rebundling of healthcare. And that begins with I've seen this term, when you hear a term once, it's a blip on the radar. When it's twice, it maybe grabs your attention. When you hear it 3 or 50 times, then it becomes a trend. And what I'm seeing is the birth of the virtual first, not just virtual care, but the virtual first healthcare ecosystem, where all this stuff begins to come together. And what you describe with Teledongo and Amwell, they're all parts of that. And it's a painful process to go through to take what's now close to a $4 trillion segment of the U.S. economy, take it apart. But I think, the optimism I want to bring, again, I hope that's a little tongue in cheek, because I can be very critical, having been trained as a lawyer, but I do try and bring a sense of optimism. I think it's going to be a lot better. It's just probably going to take 5 or 10 years before we really begin to see what this looks like. And COVID has accelerated this so much.
Let me layer something on here, because you're talking about, at the top end with the money and with these new ventures unbundling healthcare, and you've even got companies like 30 Madison, which has unbundled it down to a separate website per condition. Your condition is usually a baldness and lip male parts, and but they're doing they literally have a brand. It's not even just hims or hers or whatever. They have a brand name per condition, and it's all cash pay for sort of relatively affluent people. Then you're talking about getting into different types of areas like the virtual primary care. You need bricks and mortars as well for that. But then you've got the biggest kahuna on the block in the payer world, Optum, right? Doing this week. And I used to call Optum. I talked to Andy Slavitt years ago when he was running what was then called Ingenix, which is the Optum Analytics part now. And I said, you're already an arms dealer, aren't you? Because you're selling to both sides. You're selling to payers and you're selling to hospitals, trying to figure out, how the payers are trying to figure out how to cram down the hospitals and the billing, and the hospitals trying to figure out how to unbundle and raise it up. But now, this last week, they just bought Change Healthcare, which is, if you're going to take my analogy, the arms deal, that's the battlefield, right? That's the people who are actually moving the money around, and they probably want to put their finger in that stream a bit more aggressively. And they also have Optum Pay as well, and they're in the and they're in the middle of that as well. And I haven't done it yet, but they're in talks to buy Atrius, which is a big medical group, capitated medical group in Boston. And don't forget, they own the thing which used to be Health Partners. I think it still is called Health Partners, a big capitated group in Southern California that somehow ended up in DaVita, the kidney chain, and then got sort of spat out, and it's now part of them as well. And they own another, 60,000 doctors across the US as well. So I'm really struggling for us to understand. Are you getting really big systems like an Optum, and obviously Aetna and Cigna and the others and CBS are pushing that direction as well? Or are we going to see more unbundling? And how does that relate to the idea, JL's idea of Mike's idea, let's get a bigger team of people who can help with the pandemic, move to public health, and then presumably move to primary care? I mean, can we square these things, or is it just going to be a mess?
Well, who we're leaving out of this conversation
Jessica,
completely
then Mike.
who we're leaving out of this conversation completely are our retail health friends. Like, I drove across the country. There's a Walmart everywhere. Like, you may not have broadband, but there is the Walmart, and it is the centerpiece of some of these rural communities, and there's one everywhere. And in cities, you can find a Walgreens or a CVS, like Mike said earlier, almost on every other corner. I mean, there's 1,500 of them across the country. And if you look at COVID, specifically testing with the vaccine, who stepped in to fix that disaster? It was those companies. So I don't know how you could leave them out of a primary care conversation or a rebundling of the model into something else, when all of those companies have a telehealth component. All of them are doing prescription drug deliveries. They've got their pharmacy. They've got their on-site clinics that they're running either with a provider that they're partnered up with, like VillageMD and Walgreens, or they've got their own, like the Walmart healthcare centers or like the CVS.
Sorry.
I mean, they're like little microcosm of a healthcare system. And guess what? Everybody can afford them because there's a range of different solutions within those walls or on their website, as it may be, for you to partake in. I mean, I think that they are like, I don't feel like we as an industry are giving them enough credit for, you know, their ability to engage with consumers across socioeconomic classes, to engage with them both digitally and in a retail setting, and to build up, like, you know, the supply chain to be vertically integrated fully in order to be able to do that. And just leave the rest of this where it is. Great. You guys keep fighting about whether your EMR can take the data or not, because we've got a consumer data. How long is your CVS receipt? Mine just keeps going.
I never use that card anymore because
oh my God, because of the receipt. But all of that is data. All of that is health data. I mean, where in healthcare can you find anything even close? The data lake in a health plan? Yeah, good luck.
Yeah, I think the answer
Mike,
to your question is actually pretty simple.
Vince, Mike was trying to jump in, then you, Vince, then Lygeia.
Yeah, if ever there was a moment for people with your combined expertise to think strategically, it's now. Because for those of us who aren't as skilled at what you do, oftentimes you sound very micro oriented, fixing this problem with that problem, this client, and all of the different players within a traditional medical industrial complex. When in fact, I think where we are is very macro. We are basically on the verge of asking appropriately for a major shift in the way healthcare is organized and delivered in this country. And as Jean-Luc says, there is major opportunity, but when you talk about bundling, you tend to gravitate back to those with whom you have bundled before or wish to bundle. When in fact, there are organizations, for example, like Chiefs for Change, that represents all of the major aggressive, progressive superintendents in big cities throughout this country. And what are they focused on this week? They're focused on moving up in the immunization pathway all teachers and students. They're talking about how we bundled up students in the polio epidemic, including myself, and had the doctors all come to the school and everybody got immunized at the same time. All the teachers, all of the students, nobody was left out. So what I'm saying is there may be, because of this epidemic, a major opportunity for the people who are experts in health information technology not to reach back into the medical industrial complex, but to reach into somebody else's sector where they're already focused on the same major issue, and it's a healthcare issue. And it's an issue that requires the kind of logistics coordination that you can bring to the table, as well as the delivery component. So you know, I think that it's just like this white supremacy thing. We are never going to fix this unless we confront it. It's a battle, and you got to face these people off, and you got to beat them into the ground, and you got to say no more. And similarly with this medical industrial complex, if you keep feeding into it, if you keep suggesting that just a little bit more efficient approach will solve this problem, rather than saying, for Christ's sake, we need to have a strategic plan for health in this country. Otherwise, if not this pandemic, something else is going to knock us off, and we've run out of time. Get with it. Well, you guys have that expertise to move both the micro and the macro on this thing, and I think you got to do it. I think you got to speak to it.
Vince?
So, Mike, let me just clarify. You know, I think actually you and I probably agree. You know, if I put on my public policy lens, you know, I can certainly see how screwed up healthcare is, and I would probably agree with most of your policy prescriptions. I think the comments I'm coming from are are more of a recognition of the reality that we're in, as opposed to the reality that we would probably like to be in.
Right.
You know, I certainly personally would support a private option. I'm not so sure about universal health care. You know, that's a big one to bite off, but you know, I think directionally we're probably looking at it the same way. You know, what I'm trying to do is offer a lens through which to view the world, and it's certainly not the only one. And then to come back to your comment, Matthew, I think that to me, the synthesis of all this is really not that complicated. You know, we've had in the past delivery systems, and they're the incumbents with balance sheets that have tons of fixed capital, and the commonality of Optum and retail and companies like Teladoc and Livongo and Amwell is they're really trying to build virtual healthcare delivery systems without all of the weight that comes from having all these physical assets on their balance sheet. Yep. I just offer that as a comment of synthesis of what's going on, you know, and then we can talk about whether that's a good thing or a bad thing.
Lygeia, you're trying to get in here?
So I wanted to build on and underscore Jessica's point about not just retail, but outsiders generally. We haven't really talked too much about big tech, Amazon, Google, Apple. Those guys are huge. And last I checked, like an outrageous proportion of the Fortune 50 are in healthcare. That includes like BMW and Honeywell and all these other companies. Right. And I think that something that's going to give those kind of outsiders an extra leg up is COVID itself. And part of that is the habits that are forming, not just dealing with the sort of disease immediately and trying to stop the spread and that kind of thing, but over time, one of the themes that came out of CES is that we're going to be much more home focused in a lot of the things we do, including in our healthcare. And so I see many more of the functions that people used to go in to see a doctor for happening at home. Maybe you're being sent a test in the mail by a drone, whatever. You know, you're only going into a healthcare provider for some routine things and for the more acute and intense treatment kinds of situations. So I think this is really an opportunity for those outsider forces, and there are many all clashing together. It's not like there's just one big one, to come together and kind of pull traditional healthcare back. I think that's the general direction.
So we have about 10 minutes to go, and I think I'd like to have us think a bit. Normally I do like a 3-minute round at the end where I give everyone a good quick quit, but let's do a little bit different. You know, new year, I can change the rules a little bit. You know, we've got one that we haven't mentioned, by the way. Somehow we got through this, but between the last time most of us met together and last week, we have now a Senate that's going to change, right? And it's going to have 51 votes, given the Vice President Harris's role. 51 votes if they can, corral the Democratic Party. We know there's going to be a much bigger stimulus bill. There was $900 billion agreed just before Christmas, but the Democrats in the House are asking for like $3.5 trillion. You know, we know that there's a likelihood of a lot more activity there, and in that money, as you may remember, particularly from your past, you can bury a lot of stuff in those big programs, which you know, obviously we can start talking about some of the things you're talking about, like rural SEC, rural broadband, you know, maybe more federally qualified health clinics. Biden's obviously talked during the campaign about Medicare expansion down in age, Medicaid expansion to the states. I mean, we would have thought all of that stuff was impossible with McConnell running the Senate, but now he's not going to be running the Senate after the 22nd or whatever the date is. What do we think the policies that we're going to see coming out? We talked a lot about different parts of integration, different activities in the private sector, and the need for this public health workforce. But just to end, let's go around and what do we think is likely that after the inauguration, we're actually going to see in terms of policies in the first few months, if not the first time, or the first 10 days. Let me start with Casey. She's
Well, I think that he's going to run into the same problems that I talked about vis-a-vis the state by state issue. And, all power is not explicitly outlined, devolved to the states. Thank you, Constitution. But I do think that he's a good enough deal maker and arm twister and glad-hander that I think that he will be able to keep the Democratic caucus in both the House and the Senate in line and all rowing in the same direction. So that's a positive. But as far as exactly what he's planning to do re-healthcare, I have heard directly from the transition team and news coverage thereof that he's looking to lower Medicare age to 60 and to offer Medicare and or Medicaid based public options via the ACA to folks who don't have employer sponsored insurance. I would really like to end employer sponsored insurance, but that's a story for another day. There's also been some talk of trying to expand Medicaid in the states where it has not been expanded or where there are work rules which are really dumb. Sort of developing a play for how to stop any of the states who have not yet expanded from blocking it. But, all of this is going to happen when the rubber meets the road. And right now it'll be interesting because, man, if there's one dude on the planet that's got a lot on his plate, that would be Joe Biden. And luckily, I think that this is where Kamala Harris is going to come in handy, both in Congress as, the president, the president pro tem of the Senate. But I also think that underneath all of this, she is probably also going to be involved in this, restorative justice thing that impacts both healthcare and everything else. And I think that healthcare is a big piece of this restorative justice. And I would not be surprised to see her taking that view because she's a former, DA, prosecutor, and attorney general.
All right. JL, what do you think's likely to happen? That was the long list from Casey of what could happen.
I'd like to build on what Casey said about Medicare and Medicaid. And I said this in a previous THCB gang. We haven't heard a lot of messaging about those two programs from the president-elect, but I think the easiest way you can get healthcare to many, many more people is by loosening restrictions or age requirements for Medicare, let's say, allowing people to buy into the program, getting states that have not expanded Medicaid to do so. I mean, you could dramatically increase the number of people who have access to care. And as I said in a previous session, doctors like Medicare. Medicare is a good payer. Patients like Medicare. It is a very efficient system. It works very well. People are like Medicare. Even people who don't like socialism like Medicare, And I think that when it comes to Medicaid, a lot of hospitals would much rather have Medicaid rates than taking losses for people who can't afford their care at all. So I really do think that that's what we'll probably see. Now, as Casey mentioned, Joe Biden's got a lot on his plate, right? He's got coronavirus, he's got an economy, he's got white supremacy, he's got a lot of things that he's got to deal with. But I could definitely see expansion of healthcare coverage being something that he and his team attacks at some point in the first year of his presidency.
Mike, what are you expecting?
Yeah, I agree with Jean-Luc. I think and with Lygeia, I think that there is going to be a move toward a voluntary offering of a Medicare or Medicare-like approach, and that the response to that will drive further expansion moving toward national health care. I also believe that we're entering into a phase where the phrase "we're better than that" will no longer be accepted per se. People are going to say, prove it. You think Americans are better than that? You think we're exceptional? Prove it. And part of that proof is going to have to be to face down these white supremacists. And part of that proof is going to have to be to integrate social determinants with a real healthcare system. And very important to that is exactly what Jean-Luc says. Innovation, technology, home-based care, all of those things are better ways to bring simplicity out of the complexity we currently have.
Jessica, what do you expect Biden-Harris Congress to get up to?
I don't know, but I expect to be very underwhelmed, to be honest with you. Like, I really don't think they're going to have the ability to do very much. I think that trying to bring together a divided country the way that we are, I think there's going to be some very careful thinking about how not to rock the boat, especially in the short term. I don't know. I'm a woman jilted by Obama and Obamacare, and then what happened to us after that. And I don't quite feel fully ready to believe with any type of confidence that anything is going to change really quick. I'm pretty jaded as far as the health policy side of things go.
All right, we go from Jessica the pessimist to Vince, usually the optimist. Vince.
Well, others have focused on what clearly has been a difference around, financing of healthcare at a national level. I'll bring back the perspective, but that there has been a lot of bipartisanship in healthcare across the last 4 presidencies, and most of that has frankly been pretty good. The focus on adoption of technology, electronic health records, interoperability, getting data to patients and giving them control over that data, the push towards value-based care, even that's continued under the Trump administration. So to that extent, as I think I've said before, no one's ever accused me of being a supporter of Donald Trump, but I probably have been okay with about 80% of what's come out of Health and Human Services, with, again, the big exception being, the financing and the ACA. I think also, the reality is that on the COVID side, that a lot of what Biden's got to do is un-effing what has been effed up over the last year. And that's gonna take a while. So I don't have particularly high expectations for the first 90 days. There's a lot of work that needs to be done, and also a lot of things that probably can continue as they have been. The push towards interoperability, patient engagement, patient control, value-based care. That's all good.
So we have bundling, unbundling, effing, and uneffing. All right, to take us out, the one person on the gang who actually worked in HHS in recent memory, at least. I'm not sure you can remember that far back, Lygeia. But Lygeia,
feels like it was a
tell us what's really going to happen.
So I think, all of you colleagues have touched on the pieces that I think are really important. As I see it, expansion in coverage through one way or another, including perhaps lowering Medicare ages. Second, I do see, and maybe I'm just an optimist like Vince, but I do see further emphasis on value-based care and moving toward that. And as a piece of enabling it, technology. Those are sort of the 3 things. Again, further working on, you need value-based care to make technology really work, but you also need some additional funding and outreach to, rural areas, broadband standards, all that kind of stuff. But yeah, expansion of care, value-based care and tech. And I would finally say, I see him kind of tweaking the ACA, but not like trying to overhaul it, but saying like, we've got this thing, let's look at it and work with what use it as a starting point. Assuming
the Supreme Court affirmed it.
Yeah, they
throw it out.
So we're at the end of the show. I just say I would hold out a little. I think this depends how things go over the course. And certainly, do we get the vaccines done? How quick is the recovery from the recession? We have, Donald Trump was the first president in a long time to see the labor force shrink. We have a lot of people sitting around who've got, limited stuff to do. We talked a lot on this episode of the THCB gang about what we could do with a sort of a bigger healthcare workforce. I'm trying to think about the unemployed Uber drivers and the unemployed, how do we teach them to give a shot? And then what other things could we do? We have a lot of things that need fixing. We're talking about, there's healthcare, but there's daycare and there's a bunch of other stuff that education, we need a lot of help in. And we're going to be spending a lot of money, admittedly money we don't have, but we have very, very cheap rates to borrow money at the moment. So my sense is that I think it'll come in relatively conservative, small C in terms of what they try to do. It wouldn't surprise me greatly if over the course of the first couple of years, there's a lot of pressure built up to do more. What that actually looks like, I don't know, but I'm not as convinced that we're going to have as little. And I was reminded by somebody on Twitter the other day that when FDR came in, he didn't talk about doing that much, but over the course of how bad the recession got, and over the course of being pressured by the then left, he ended up doing this radical thing called the New Deal. So we shall see. It'll be interesting. All right, and that is where we are today on THCB Gang. I want to thank all of my guests again. Jessica DaMassa from WTF Health. She's running off to go and interview the Hinge Health people I know. Mike Magee, medical historian from Connecticut. Casey Quinlan from the mighty, the capital of the Confederacy, Richmond, Virginia. Very proud for you, Casey. Lygeia Ricciardi from Washington, D.C., the current capital, and hopefully not the site of an insurrection in the next few days and weeks. Neptune from Suntra recovery up in New York City, and Vince Kuraitis from the wilds of Idaho, where I assume all the white supremacists are going to return and take.
I'll observe nice trout.
Absolutely.
Nice trout.
Absolutely.
Thank you. Kids gave it to me.
So with that, this has been Matthew Holt signing off. This is the end of episode 38, the January 14th edition of THCB Gang. Next Thursday is the inauguration. We will have a immediate post-inauguration special at 1 o'clock Eastern, 4 p.m. Eastern, 1 o'clock Pacific, and we will see you then. Thanks, everybody.